Good morning, everybody. I hope you enjoyed your breakfast and we are ready to have a lovely day and inspiring day also. I'm Dimitris Kotopidis. I'm chair of European Lung Foundation. I'm cystic fibrosis patient. I'm from Greece, and I'm happy to welcome you here and to have a fruitful empowerment day. So, today here we love technology, so it's an hybrid event, except from all of you that you are here in Vienna with us. We have a lot of patient representatives and patients connected online, and I hope everything goes smoothly and you hear us also to continue in our patient organization day. So, let me see. Here is the pointer. What is the theme of the day? It's the theme that we face in all of our lives, fighting to have a better healthcare, to have equal healthcare, independently in which country we have born, and of course, independently of what disease we suffer from. So our today tasks, our today theme is driving policy and healthcare change. How we can make this change? Of course, with exchanging knowledge, experience, through the different lives we have in different countries. Before we start with what we are talking about, I would like to thank you to our working group that they have come some days before to prepare all of this wonderful day. And let me tell the names. It's Jean-Michel Fourier, Deborah Montag, sorry for my pronunciation, Abdullah Hissan, Liam Galvin, Lara Consani, and Stefano Vanello. Thank you very much for helping us. And we like technology, we like design, we like arts also. Do you know, a lot of times in the conferences, we talk so many things that we forget them. And then we are looking for notes. What was the important, what we have missed. So today, we have Chiara, the chair. It's visual artist, and she will draw all the important things in order to remember them. So it's an extra thing that we hope help us in our conversations. And now is a poll time, and we will have a lot of polls during the day in order to see what is the average of thoughts, of experience in the topics that we discuss. You can scan, you already do it, and when you are ready, we can push the start voting. And the question is, we would like to rate from 1 to 10 the knowledge that you have in policy change, or that you believe you have. Eh? Okay, let's start voting. Ready? Okay, we will give some seconds. 30 seconds, I think, is good. We can see online real time the voting procedure. Let's wait a little bit more. I hope you are okay with your mobiles. Okay, we have a result. As you can see, we believe, most of us, that our knowledge is at 5, good, but it can be better. So as the sky is the limit, let's touch the sky together, today together. Okay, now we have the results. Let me speak a little about my advocacy journey. I believe that you have similar journeys as we face the same problems. And the problem is that we have difficulty to have unlimited breath. Okay, and in different countries, we try to find out how we can save ourselves. And a lot of times, you know, it's not about the disease. It's the healthcare services that each country provides. And all of this difference It's about how we can make better the services, the healthcare services. So let me introduce myself with some photo albums that I have. First of all, I have studied graphic design first, then I was in Madrid for fine arts, and finally to study architecture, so nothing to do with health. As possibly a lot of you have your personal life, personal jobs, personal dreams. And during this journey of life, trying to do the things that I like, as a CF patient, most of the life was inside the hospital. A lot of you know that in cystic fibrosis, we need every 2-3 months to go for intravenous therapies, and of course in the morning, in the afternoons, to make a lot of physiotherapy and a lot of drugs. And I think similar problems will have all the lung disease. So when you grow up, you understand that we have a limited life average of surviving. And in cystic fibrosis, in 1980, that I was born, the survival rate was about 18, 20 years old. And indeed, every month that we were going to hospital, we were seeing how much friends we didn't see from the last time. And this was shocking in adolescence. It was shocking until now. And, you know, a lot of times you don't accept what's happening. And you believe that maybe it can be something, it can be changed. So losing my friends during my hospitals, I decided to give up architecture, to give up everything, because how we can build nice houses when we don't have our friends and our beloveds to live there. So I take it personally and say, let's see what we can do. And of course, I cannot do it by myself, but were some patients and fathers and mothers that say, okay, let's see what we can change in Greece. As in Greece, the survival rate was 10 years less than UK, for example, with the same disease. So there was some problem in the healthcare service in Greece. Okay, 2 minutes. The first thing with the images that we have in Greece is that we go to demonstrate out of a hospital. You know, to have a placard, to make some strikes, and of course we cannot achieve nothing with this. Then I was familiar with European Patient Forum, and then I learned that with patient advocacy, we can see how we can change the system. The first tool that we can use is our personal stories. And we can take some cameras to go to some hospitals to describe what it is to live with a problem. And I'm sure a lot of you have done it. And in this way, they know what's about. That we are not numbers, we are patients, we have lives, and everybody can do something more. Then you understand that we have empowered communities. It's not a story that you have to keep it secret, but we have to take action with a lot of volunteers that they are there and they want to help you. So we have to find a role for volunteers to help you in this experience. Of course, you can make a lot of political interventions. And for example, here it was about intervention for reimbursement of oxygen that you can have together. And with some statistics from other countries, you can approve that it happens to other countries and it has to happen to your country also. Here I have a path as candidate in European Parliament, so I learned a lot how the politics works. And the politics want results, want votes, and we can bring solutions to make it easier. I don't want to tell more about this journey because a lot of you have made a similar. But being part of Cystic Fibrosis Europe, a large European community, they help us to take the innovation therapy before some 4 years that became. And this is proof that European collaborations can help us to survive. So now that I'm finishing very quickly my personal story, a lot of you know that I have denied my lung transplantation here in Vienna, that was in the list, in order to bring therapy in our country. We achieved that, and we are here today because we don't want other heroic patients. We want to have the solutions in order to live a normal life. So I'm very happy to introduce you in the first panel, Michaela and Ed. That is, Michaela is a lot of year experience, and Ed is a young entry, very powerful. And before I sit them with her and to discuss together, I want to underline that this is not one-man persons or patients, only patients' voice. A lot of times the multi-stakeholder collaborations, like the Maria Gappa that we have together, Maria Neira from from HWO will help us to see what is the best for patient strategy, journey, and advocacy. The panel, the floor is yours.
Thank you so much, Dimitris. Yes, and like Dimitris said, my name is Michaela Odemyr. I am the president in the Swedish Asthma and Allergy Association, and I'm also chair in ELF in the Patient Advisory Committee. And I am also a pleasure to co-chair today this event with you and also the participants, not only here in Vienna, but also online. And I will ask now my co-chair to introduce himself, please.
Thank you, Michaela. My name's Ed Powell. I'm a 17-year-old bronchiectasis patient from the UK, and I'm a member of Child Barenet. I'm an ELF council member like Michaela, and I'm also chair of the ELF youth group. It's an honour to have you all here today, online and in person, and I look forward to co-chairing alongside you, Michaela.
Thank you. So we will now move on to the housekeeping. There is just a few bits to mention. There will be a question and answer session after each keynote speaker, and then again after our second group of speakers. So the attendees here in Vienna, you can raise your hand and then someone will bring the microphone to you. And this is extremely important. Please don't start talking until you have the microphone, so everyone hear your question. And online, you can then write in the chat box. And Ed and I will try to bring as many questions as possible during the Q&A session. And if you need support, there is a ELF staff available in the room, and I think they will wave now. So if you look around, there you have some there, just so you know them. And for the people online, there is an ELF email address on the slides if you need support, so just write there. And this event website, you have all the details, as you can see here, and you can just scan the QR code, and you will then get the program and all the speakers. And this event will be recorded and will then be available on ELF's website, and we will send a link when it's available, so everyone can access it freely. And please do get involved. Chat on social media, and also here with the people, and please tag ELF in your post so you can see the hashtag. I can see it, yeah, you see getting involved here on that section. And then we have some stickers here that some need a bit of distance, so we have this social distance. So if they have this sticker on, keep me safe, so give them a little bit more space, even though we like to hug and be close. So have a look at, that will be on this one. And we have built in several breaks into the program, but feel free to step out anytime if you need a break. And finally, turn off your mobile phone and keep them on silent. So, over to you, Ed.
Thank you. So we're going to start off the day with a networking activity. So it will be a chance for you to network and meet people that you haven't spoken to before. And we've got around 15 minutes for this activity. So for all the people online, if you've registered already, then you will leave this live stream and join a Zoom meeting for your network activity. but this is only for people that have registered in advance. So if you've just joined the live stream today but did not register in advance, I'm sorry, but you can't take part. But please do rejoin at 11:15 for the keynote speaker. So if you have registered online before, you will already have been sent a link to the Zoom meeting, and it's also been posted in the chat. And then if you click on that link, you will meet Claire, who will give you your instructions for what to do. For everyone in the room, you should have on your table some stickers, which have got different colours on them saying, "Hello, my name is." If you could fill those out with your name and stick them on yourselves if you haven't already, you might have done it when you came in, that would be great. So what we're going to do is when I give you the signal, which is going to be the ringing of this bell, we're going to ask you to move around the room and try and find someone who's got a different coloured sticker to your own, and then have a chat to them about, and then ask them some questions. So there are some questions that you can ask them anything, but we've also got some questions up here on the slides as well to ask them if you would prefer. It will be a 3-minute quick chat, then I'll ring the bell again, and then you need to try and find another person. Yeah, hello. Hi. Hello? Does that work? Hello everyone, can we start taking our original seats, please? We now have our keynote speaker. I hope you've had some time to make some new connections. Do keep talking to others throughout the day, though, and keep finding out more about each other and the work you do. So we'll just wait for everyone to sit down, and then I'll hand over to Michaela.
Well, it was quite amazing to sit here and see all the people moving around and chatting, and I hope you had the same lovely time online also. So bringing back you now to the next topic, empowering patients to drive policy change, clean air for better health. This is something that is very, very close to my heart and also extremely important. And I think since the pandemic, people had really realized how important the lungs are. So now it's my pleasure to introduce our keynote speaker for today, Dr. Maria Neira. Dr. Neira is a doctor of the Department of Environment, Climate Change and Health at the World Health Organization. Dr. Neira started her career as a medical coordinator for the Médecins Sans Frontières, working in conflict zones in Africa. She's a trained medical doctor specializing in endocrinology and metabolic diseases, with additional qualification in public health, human nutrition, and crisis and management. Following Maria's talk, there will be a 10-minute question and answer session for you to ask directly to Maria and really take this opportunity. But first of all, I will hand over to Dr. Maria Neira. The floor is yours.
Thank you very much, and what a pleasure to be with all of you. First of all, I suppose we need to say Happy Clean Air Day. It's a shame that we need to celebrate clean air only one day. I think we should have a clean air every day and not just today. Blue skies is the topic as well of the day, and I'm afraid many people around the world cannot enjoy blue skies every day. But the reason we are here is not just to talk about the beauty of the blue skies, but what is the influence of the quality of the air we breathe in our health. And I think this opportunity you are giving me today is amazing, because we need your engagement and fighting for tackling the causes of air pollution, which is very much responsible for most of the diseases, or it represents a risk factor, a very important one. So I will love to explain, to exchange with you how to empower the patients to drive the agenda and to make sure that we can influence a little bit more. I don't have any conflict of interest. I am a medical doctor. I work at the World Health Organization, and I'm a very passionate, or I think I am passionate, public health officer trying to protect people's health. I'm sure you know this little face, this beautiful girl, this painful story of Ella Kisi Debra. Air pollution, a cause in girls' death, coroner rules in landmark case. This is very painful. I know personally her mom, Ella's mom, is a desperate mother for 10 years fighting to make sure that her daughter passed away, which is nothing we can do about that, but at least she's fighting to make sure that other kids, other girls and boys will not go to the painful case of treating the asthma that she was suffering, the doctors doing an incredible job on stabilizing her, and then sending her back to a very polluted area in London, where she was breathing again this very polluted air, which was causing again a horrible presentation of an asthma case. So now we have in her death certificate for the first time ever as the cause of death, air pollution. But let me take you to something that probably you know extremely well, which is the big picture, the data you can use if you want to advocate for fighting the causes of air pollution. This is the big picture, a horrible number, which I repeat every day several times, and I still have difficulties on understanding how can it be possible that we have every year 7 million premature deaths caused by exposure to air pollution, and still we are sitting here and not going to the headlines of the newspapers and reaching every single newspaper headlines, and all politicians being under pressure to do something about changing this and creating an international crisis. 9 out of 10, according to WHO estimates, people around the world live in areas where air pollution, air quality exceed the limits that WHO is proposing as the healthy ones. Of course, it's not the same breathing in Mexico City or New Delhi or Shanghai or many other places around the world that living in Geneva or even in Vienna, where the quality standards are not the ones recommended by WHO, but they are maybe exceeding by 2 or 3 and not 100 times as in many other places around the world. So we are still relying on very polluting sources of energy, that the combustion of these polluting sources of energy are responsible for the causes of this air pollution. And we could prevent, and this is the positive part, that we will be able to prevent 25% of the global burden of diseases. So the number of deaths we could prevent every year is an incredible motivation. As you know, air pollution is responsible not just for respiratory diseases, which will be already something dramatic, but stroke, heart diseases, COPDs, lung cancer, pneumonia, and many, many others. I will tell you more later. You know how much we are trying to include air pollution as a risk factor of non-communicable diseases. We have 5 main non-communicable diseases: the cardiovascular diseases, chronic respiratory diseases, cancer, diabetes, and those are the 5, I would say, well, mental health is included as well, and we have 5 main risk factors. One of them is something that you know very well, which is tobacco use, and then unhealthy diet for cardiovascular diseases, for instance, a harmful use of alcohol, physical inactivity, one fundamental one, particularly for the respiratory diseases, is the air pollution. So I really hope that we will be able to make sure that everyone understands that as important as fighting the tobacco consumption is the fact that we need to fight air pollution. What are the health effects of the particulate matter, those little things that they bring to our lungs, and from there they can reach every part of our body? The message here is that air pollution can affect almost all organs in our body. There is no organ that will be protected, because once you breathe it, they are so teeny, those particles, that they can go to our lungs, but then from our lungs to the bloodstream, and then it reach any part of our body. And in fact, air pollution will be responsible for, of course, respiratory diseases, which is the most well-known, and we have tons of scientific evidence demonstrating that. But we have as well tons of evidence thousands of scientific papers demonstrating that it's affecting cardiovascular diseases, lung cancer, type 2 diabetes, what a surprise, cataracts, pregnancy outcomes, skin aging, this is important as well for ladies and others, neurodevelopment, and of course, I think the package is big enough to motivate all of us to do much more. So which individuals are more at risk from air pollution? Well, of course, susceptible people will be, age will be a factor, will be very young children or very old people. Of course, depending on the life stage where you are, if you are pregnant, of course, you are more susceptible. But patients, those who have already pre-existing comorbidities like the cardiovascular and respiratory diseases or obesity or diabetes mellitus. And then who is vulnerable? Well, lower socioeconomic areas. We saw the case of Ella Kisidebra. Like her, people with low socioeconomic level will live in areas that are more polluted. The richest you are, probably, even if you cannot choose the quality of the air in the city where you live, because you are forced to breathe whatever is available, but still, if you are rich, maybe you are a little bit protected on the place where you live, you have a nice garden or something like that. And then occupational exposure, you have all of those workers outside in New Delhi, for instance, you will see then what they are breathing on from the traffic, or those who have precarious living conditions or very risky works where they are very much exposed. And then, of course, almost half of the world population is living in places where they do not have electricity. I mean, something that you arrive at home and you click and you have electricity. No, they need to cook or heating or lighting their house with an open fire, for instance. And that is, of course, generating incredible pollution, and these people will be very much vulnerable. Do we have something in common between climate change and air pollution? Yes, very much in common because of the global sources of urban ambient, I mean the PM 2.5, those particulate matter that come to our lungs, they come from the domestic fuel burning, from transport, from industry, from other human origin or natural sources as well. And when you look at the global sources of greenhouse gases emissions, they're responsible for climate change, you will see an incredible overlap. More than 75% of the sources overlap with each other. So 2/3 of outdoor air pollution emissions are generated, very simple, by the combustion of fossil fuels. So that's why you as patients, you need to advocate for transitioning as fast as possible and as ambitiously as possible to clean sources of energy, because those are the ones that will protect us from breathing toxic air. So what is the role of the health workers? You can say, well, we need to take care of the patients, we need to treat patients, so our role will stop there. Well, no, we have a massive role, and we have a credibility, we have an influence role, so we need to use it and make sure that we extend our role beyond the clinic, because it's not just treating the asthma of Ella Kisidebra, is very much about advocating for Ella to breathe cleaner air in order to prevent the horrible outcomes of asthma attacks that she was having. In addition to that, the health professionals, we still have a trusted voice, and we should maintain it. We are among the most trusted ones for our patients and our communities, so we need to make sure that we, in all levels, at the micro level, directly with our patient, telling our patient that they need to pay attention to the quality of the air where they live. Unfortunately, they cannot choose that. The meso level, particularly with those vulnerable people, workers, they can maybe create trade unions and fight for it. And at the macro level, obviously, we are even infiltrating the climate change health community, the COPs, the negotiating on the climate change. We need to be part of that. So for your information and those who are interested, I'm sure that we will collaborate on that. We have created an open WHO online training course easy and free access. Of course, that's all the material of WHO. This course will look at the main health impacts of air pollution. So if you need to use it to convince other people or to pass the message or for yourself, this is an open and freely accessible to everybody. It checks the knowledge we exchange, and of course this course will look at the connection as well between air pollution and non-communicable diseases, chronic diseases, and it will give you even a little certificate of achievement if you are interested on having that. Until now, we have more than 10,000 enrollees already joining, more than almost 2,000 health professionals, students, representatives of Ministry of Health. I'm sure that the youth associations will join very quickly. And Samantha Pecoraro, Dr. Samantha Pecoraro, who is there, she's the responsible for this project, so I'm sure that she will be able to give you more details if you are interested. As I say, we need to empower the health community and beyond. And this is why we have been representing our voice at all the COPs, I mean the negotiating processes for climate change. Last year in Dubai, before in Sharm el-Sheikh, before that in Glasgow. So we are bringing the voice of the health community on a very strong way. And thanks to that, we have been able to launch initiatives and looking at climate change and health, and arguing that when you mitigate the causes of climate change, to mitigate the causes of climate change, you need to transition to clean sources of energy, and clean sources of energy means reduction of air pollution and therefore huge protection of the health of our patients, respiratory and far beyond that as well. Last year at the COP28, for the first time ever, we had a health day, a dedicated health day, and we were able to have an unprecedented number of health professionals represented there, millions represented as well online or virtually, supporting us, and then making sure that more than 50 ministers of health attended, and making sure that everybody understands that when they are negotiating the level of emissions, the reduction on emissions of greenhouse gases, they are not just negotiating numbers or percentages, they are negotiating with our health. Because if they are not ambitious on their targets or reduction of emissions, they are not protecting our health, and we can even calculate how many cases of lung cancer we are going to have if they don't take the measures to reduce this fossil fuel combustion and transforming and transitioning away. So we want, for the next COP, which will be in November in Azerbaijan, in Baku, we will love to have the powerful voice of the Patients Association. So we count on you, and this can be the opportunity to raise and join in forces, and your voice will be very powerful together with the rest of the health professionals. I think we can multiply our effects and hopefully making sure that everybody will wake up and take more action. Today is the Cleaner Day. These type of days, they have an importance because they raise awareness, they mobilize the communities, they raise attention of politicians, at least for one day or 1 week, they do something about air pollution. But our responsibility is make sure that this Cleaner Day is every day. We need to make sure that the standards recommended by WHO in terms of air quality are by law. That will be a dream, to have it by law in every country. If you think about, I don't see any really controversial. The same way we have standards on clean air. I mean, when you open the tap with water here, if it's water that you can drink or at home, of course you have an standards of the content of that water and making sure that there is no arsenic inside, or what are the level of protection you are getting. And any one of us will be accepting different standards. We will imagine that the standards on, on water quality are going down. This will represent diarrheal diseases, outbreaks everywhere. So we are not accepting that. Why not having very strong legally endorsed standards of air quality? After all, we are having deaths as well. Maybe it's not like an outbreak of diarrheal diseases, but it will be people coughing, it will be people with a lot of respiratory difficulties, and the medium and long term, people having lung cancer and many other diseases that definitely we don't want to accept. So for me, it will be a dream if a logic and a basic dream if one day we have standards by law in every country about the quality of the air we breathe. So, as a patient, I'm sure you know that very well, you have rights. We have rights. We are all patients at one moment of our life. So we all have rights, and we need to make sure that we are informed, we are involved, we mobilize our community. We need to ask our health professionals about air pollution. What do they know? Whether they are empowered with that, whether they have information that the air pollution is a risk factor. We need to use our political power. Don't forget that we can vote every year or every 2 years or every 4 years. We vote. So make sure you vote somebody who will have a program protecting and reducing air pollution, because in order to reduce air pollution, you need to put incredible, beautiful measures in your city, so you will have many other benefits that will go with that. If you raise questions to health professionals, they will be more motivated to know and having interest on the patient and individual, and of course, more education about how air pollution is impacting our health. And of course, we need to know more about the diseases that are associated with exposure to air pollution. So use your voice. You don't need to be so vocal as this little boy, but make sure that your voice is strong. Fully integrate air pollution as a risk factor for respiratory diseases within your agenda, and announce to lead by example for others. Of course, we need to lead by example. If we are arguing about the importance of clean air and then we drive one of those very pollutant cars and maybe then, or we use wood at home, or, then our credibility might go a little bit down. But we need to demand for action to local and national decision makers. Your mayor, talk to your mayor. Make sure that the mayor understand and put pressure on them, because they can take a lot of measures, particularly on sustainable public transport, that will contribute enormously to reduce the pollution, and participate in other sectors. Breathe Life, I hope you all know this campaign. It's a WHO and UNEP and CCAC campaign. Very nice, where we can collect a lot of samples and can give you a lot of information about the pollution. Next year, we will have a huge conference on air pollution and health, huge in terms of impact, not in terms of number of people attending, but we want to raise awareness and make sure that the science will force us to take action. Numbers and action, this is what we want, solutions. We want to confront the mayors with solutions, and governments and everyone on tackling the causes of air pollution. And because I have exactly 7 seconds to finish my speech, I don't know how I did it, because, being Spanish, I am not good very much with the timing. I will now ask you, there is a slide now, and this is the question for the audience to open the debate. So my question to all of you to start this debate is, what is, in one word for you, how patient organizations can accelerate action for clean air? So how can you accelerate action for clean air? I leave it there. I think it's just a one. You know how to do it, do you? Yeah. Okay.
I will bring the microphone to you. You can sit.
Okay. Interesting. Advocate. Education, unions should lobby, protest. Good, I love that. Funding, very good, and lobby, absolutely. I think I agree with that. Pass it over to you, Chair. Thank you very much for your attention.
Thank you so much, Maria. It was such an interesting and an important topic and presentation. So we will now move on to the Q&A session for our keynote talk. So if you are here in Vienna, like I said in the beginning, you raise your hand. I always see raised hands. And if you are online, you write in the chat box. So, and we also have one extra guest here on the stage. That is Barbara Hoffman, who is the chair in advocacy at ERS. So I saw the first hand there waving. So, and then we will take the next question online. So we will share. So please.
Yes. Good morning. This is Shankar from India. I am representing a organization called Empower India, and also I am the founder of Global Lung Diseases Affected Community. I myself a community, representing the community. Thank you, Dr. Maria, for your wonderful speech. See, as far as India is concerned, you have mentioned many factors that leads to air pollution. But in Asian countries, these firewoods make many air pollutions. The women, they used to cook through the firewoods. That is causing a major pollution in most of the Asian countries. And another thing, especially in my country, these thermal projects is coming up like anything. The Western countries, they are moving to alternative energy resources. But unfortunately in India, that thermal projects are going up like anything. So these are all our main concerns as civil society and patients. So I would request to WHO to intervene in such happenings. The countries, they should take pledge to move on to other energy resources instead of thermal projects. Thank you.
Okay. You want me to address this?
Yeah, I think so.
Thank you very much for the question. And India is one of the countries that unfortunately air pollution is an issue, but it's true as well that the associations in India, the NGOs, the different associations, groups, foundations are extremely active on air pollution. So thank you for that, and keep with the battle because you have a good one. Yeah, it's true. Indoor air pollution is one of the biggest causes of contributing to even not only indoor air pollution, but it contributes to outdoor air pollution, ambient air pollution. And one of the reasons is that, as I mentioned before, almost half of the world population is still cooking, heating, and lighting with very, very basic ways. I mean, sometimes an open fire, sometimes they use even, coal, or they use whatever they have available, wood, and then they spend hours to collect the wood, if it's the case of Africa, for instance. In India, I know that there is a program for accelerating the transition to LPG, liquefied petroleum gas. The government has been investing on helping families to move from the use of coal, for instance, and having access by subsidizing LPG. LPG is still a fossil fuel, but at least from the health point of view, we see it as a kind of transition solution that can help on reducing that massive pollution. So they are solutions. So the government needs to do a very good assessment of what are the sources of indoor air pollution and helping the poor families, because those who are using this type of burning at home are poor families. So through subsidies, helping them to access to other cleaner sources of energy as a transition, and hopefully one day everybody will be able to have solar panels or another system of renewable energy that will be reducing that pollution. Thank you.
Thank you. And I think Barbara would like to add something.
Yes, thank you very much. Is that working here? Yeah,
Yeah.
it is. Well, first of all, thank you very much for that question, and thanks, Maria, to this wonderful speech you just gave. You know, and one of the things that came to my mind, what actually all of you just said, education. We need education, of course, for the population, but we also need education for the policymakers. They often do not know about these relationships between indoor air pollution, cooking habits, and what a substantial amount of disease that is being is caused by that. So they need to know that, and in addition to that, they need to know how expensive it is, because all of these diseases, they cause a lot of costs to the healthcare system. So we need to also translate all the disease into costs, because that is usually quite important for policymakers. And one other point I want to make is, you know, we in the Advocacy Council at the European Respiratory Society, we take the evidence on air pollution and lung disease, air pollution and heart disease, and we synthesize this in nice little papers and then bring it to the policymakers and tell them about it and give them the scientific facts. But what is extremely important is to also pair with your voice, because your voice is very convincing to policymakers. If you stand up and we go there together and we tell them, you know, we give them the facts, the scientific facts, and then you tell them about what it feels like as a patient to breathe bad air, and that is very convincing to policymakers. So it is absolutely necessary that we do this together as a team. Thanks.
Thank you. And now?
We now have a more specific question online. Thank you for your presentation. They wanted to mention that NTM, or non-tuberculosis mycobacteria, are everywhere in the environment, but they're really unknown. So how could you make people more aware of these NTMs in addition to the pollution?
It was multi-drug resistant tuberculosis, you mean?
Yeah,
Yeah.
non-tuberculosis.
Okay. Well, maybe Barbara will address this better than me, probably. But from WHO point of view, what we are trying to do is to have this One Health approach that you heard by now, all of you, where human health, animal health, and environmental health are so much connected. One of the ways to prevent multi-drug resistant tuberculosis is the rational use of antibiotics. And the antimicrobial resistance is one of the big public health challenges we are facing now. So the rational use at the individual level, at community level, by our physicians and health community as well, and then protecting the environment. Last week, we launched a report on how we could see the residues of antibiotics, manufacturing antibiotics in water, wastewater. So we need to make very much aware that the use of our antibiotics will end up as well on our environment, and from the environment we can contribute to the resistance of our antimicrobials.
Yeah, just to add a little bit to this, of course, once again, education is very important, but then also on a more, let's say, medical level, we are, writing guidelines for doctors how to use antibiotics to prevent the creation of multi-resistant microbials. So that's an important part of, the guideline development is an important part of the medical work we're doing in the ERS.
Thank you. And we have now one last question from the floor, please.
Thank you. Hello, this is Vildana from AAA, Association from Bosnia and Herzegovina. Thank you, Doctor, for great presentation, and thank you for coming here today to talk to us. So this is something that is more like comment and suggestion and asking to World Health Organization to be more open in all Europe and worldwide countries, I think you can put patient organization in your, let's say, strategy for cooperation, because we cannot communicate with you in your branches. You know, you're very close. And it will be great if your representative, for instance, in Bosnia and Herzegovina, would be more open for cooperation with us. Because, you know, patient organization, and you know, and I see this as a, let's say, step forward, but we do great things. And if we can advocate together to policymakers, that can make real change. So thank you very much. It was more like a comment.
But it was a great comment.
I think it's a very good comment, and it's me who thank you very much for the opportunity to engage with you. You are preaching to the converted. I am totally converted of the role of the patient associations, and let me tell you one of the reasons why. When I was a very young doctor, I was, the HIV/AIDS was kind of emerging, and I saw very well the role that the patients associations can do on a disease that at that time we didn't know the origin, there was no treatment, anything. So when patients associations are strong, you can move mountains. So I really believe on that. And I think on tobacco, they have been an incredible role as well. So I'm really preaching for having now this role on air pollution and other risk factors. So from my side, you know, WHO is a big organization, but it's about individuals as well. So from our side, you can count on the interest on having you on board and making sure that we take advantage of the incredible influence and mobilization and empower that you have. Thank you.
Thank you. That's all we've got time for in this Q&A session. Sorry. I'd like to thank both you, Dr. Marinera and Barbara, for your insights and for the amazing presentation. Just before we bring this session to a close, I'd like to, to a break, I'd like to see if we can go to Chiara, who's doing the visual notes. See if we can project that up onto the screen. Okay.
Oh, yeah.
Okay. So we've had our first speaker, Dr. Marinera, and now we're going to have a 15-minute comfort break before hearing 3 more talks from our patient organization representatives. These talks will start promptly at 12:05, so in 15 minutes. So please be back in your seats by then. Tea and coffee is available, and the live stream will start again at 12:05 sharp. Thank you.
Thank you. And I hope you had a good break, both here in Vienna and online. They have very good cakes and coffee here in Vienna. I would now like to invite our first speaker from our patient organization network to come to the podium, Dr. Nicole Haas. And Nicole is an expert in patient advocacy with over 12 years of experience in the chronic patient sector. She played a key role in establishing the International Patient Advocacy Department at Grifols, a pharmaceutical company, and advised the Federation of Respiratory Patients of Spain on its international expansion and involvement in global respiratory patients platform. And in 2020, she founded the National COPD Patient Association, APEPOC. So over to you, Nicole. The floor is yours.
Thank you very much, Michaela. Thank you very much to Alf for inviting me for this important meeting. And thank you all for attending this presentation. Hopefully it could be interesting and maybe useful, you never know. After this inspiring presentation of Maria Neira, it's quite a bit difficult anyway. So first of all, of course, I have no conflict of interest for this presentation, and I would like to introduce you our campaign about the COPD ambassadors, engaging political decision maker. We carried it out with our association, with the APEPOC. APEPOC is the Spanish COPD association, and it was quite interesting and, as I said before, useful, very useful. So let me say something about the Spanish public healthcare system. Our healthcare system is organized at a national and regional level. This is important to mention because if you want to achieve something, really, you have to speak to the national representatives and you have to speak to the regional representatives. Our regional representatives are based in 17 autonomous communities, and sometimes it's a bit difficult to coordinate the national healthcare policy with the regional healthcare policy. What we did, we had a lot of meetings with all the responsible, with all the authorities at national, at regional level all over Spain. Here you can see this here you can see it. You can see the map of Spain, because we wanted to transmit them the importance of the COPD. As you know, and I suppose this is the same in every other European country, unfortunately, there is very little awareness of COPD. Most of the people not even know what COPD really is. So in our case in Spain, we have a prevalence of 11.8, according to a scientific study which was published in 2018, the EPISCAN 2, sorry. Although, if I'm honest, I should mention that probably the prevalence must be much higher, because these studies only count people on 40 years old. And in our association at that moment, we have a lot of younger people as well. And this is what Maria Neida mentioned before as well. So another big problem we have, and I suppose very similar to your countries as well, is the incredible and absolutely scandalous underdiagnosis. We have an underdiagnosis, again, according to the scientific study, EPISCAN 2, of 74.6%. Can you imagine this? That's just what I said, scandal, really a scandal. So this is what we wanted to change. And if we want to change something, we have to go to one of the main stakeholders. And one of the main stakeholders are the politicians. The politicians, they have to change the law, and they have to give us much more coverageness, and they have to increase the awareness of this disease. What we did, we had a lot of meetings, to be concrete, 135 meetings all over Spain. You can see it here. We spoke with all regions of Spain. You see the logo of the flags here, and with all parties at the same time as well, because healthcare is not a thing of ideology. We have to speak to all political parties. This is very important. Of course, it was very time intensive. We had these meetings online and also in person, and we tried to explain them what's going on with COPD. What is COPD really? What is the burden of our patients? We gave them some health data, and we spoke also about health costs. This is quite important as well. It's difficult, sometimes it's quite difficult, because if the authority is a doctor or a nurse, you will not have any problem. But most of our political decision makers are not doctors, are not nurses. So we had to explain them everything. After it, we really noticed that some of them were very much more engaged than others. All the time helping us with a social network, giving us a lot of coverage, organized some interviews with journalists, very great. So what we decided is to recognize this outstanding support provided by this important number of authorities, but also of public institutions. We decided to award or to reward 13 important authorities, normally a member of parliament, spokesperson, ministers, and others, and also 11 public institutions in order to give them a special award, what they have done. Come back to the award. I think that's quite interesting as well. You know, we wanted something special, very much representing our association and COPD at the same time as well. So as we are very much committed to sustainability, we have chosen this eco-friendly wooden plaque, which was made by a woodcut artist, and each plaque, this wood plaque, was included with the name of the authority and with the date as well. Here you have the list of the authorities. You see the list of these 13 names and also the parliaments and the Senate. Always with the Twitter account and with the LinkedIn, because this was one of the important interactions with them. Here you have some examples. This is the former Minister of Spain with the Director General of Pharmacy, very important for us because they achieved the best treatment, the triple therapy for some of our region where we didn't have it. Other examples here, the Congress of Deputies, they put it there in their newspaper as well, and in every networks. Here's some of the regional parliaments. We didn't give the award to all the parliaments, only to some of them. Only to them who really deserved it. Some of the authorities as well. I'm coming to the end, sorry. So what I wanted to tell you, these political decision makers, they were very surprised when they received their award. It was strange for them because normally they are the one who give us the award. In that case, they received an award. So that make us a lot of press coverage. They helped us a lot, and they're still, and we wanted them to still be engaged with us. This was part of our objectives. Let me give you some takeaways, some arguments which could be very interesting for you if you have a contact with your healthcare authorities. On one hand, and I think we have to underline this, and this was said also by Maria Nader. On one hand, observational studies in large patient cohorts have shown that at least 50% of patients diagnosed with COPD of 60 years old of age already had lung function changes at 25 years of age. That means that prevention is absolutely necessary and very important. Any early COPD diagnosis can impact positively on disease progression. And another thing I would like to underline and give you a bit this little tip. According to some white papers published and also to our experience, the most important information channel really was or is the media, newspapers, television, interviews, and so on, and of course social networks, especially if you're talking with politicians, or especially Twitter and also LinkedIn. Thank you very much for this. Thank you for your attention. Open to your question.
Thank you very much, Nicole. We're going to have a Q&A at the end, so yeah. So next, I will now invite Dr. Evi Hatziandreou to present. Evi is a healthcare and life sciences expert. She's the Global Senior Director for Health Policy and Market Access at the biotechnology company Organesis and the Vice President of the Fairlife Lung Cancer Care. If you can just make sure you stand near the microphone.
Yes, thank you.
The floor is yours.
Great pleasure, and thank you so much for the invitation. I'm delighted to be here and spread the word of what we do in Greece. Let me say I'm discussing on behalf of Fairlife, the only NGO dedicated fully to lung cancer. And we aspire what Medicine 3.0 does, and I hope you all know, the 4P medicine: predictive, preventive, precision, individualized, and participatory. That's why we're all here. The 4P medicine includes us, and we have to play a major role. So Fairlife was founded by Ms. Corinna Bell about three and a half years ago in memory of her husband, Simon, who lost the battle with lung cancer. Corinna is a professional in marketing and in communication, and she made miracles within 3 years, adapting and making Fairlife known to the Greek public. So it's the only nonprofit organization dedicated to lung cancer. And the mission is the mission we all have. First of all, inform and raise awareness, but then support those who suffer and their caregivers. And of course, in addition, besides supporting access to everyone, doing the lobbying and advocacy that it's absolutely needed from our organizations. So I would like to give you these 2 bits and pieces about our organization before I move on to the activities I'm here to share with you. Our footprint during these past 3 years, first of all, we cover the wide range of things that an NGO could do, from conferences to scientific publications, all the way to well-being activities. More than 20,000 people have attended our organizations and webinars, and most importantly, more than 600 patients and caregivers have been supportive psychologically through our network, getting social guidance and psychological support, translating into over 2,000 hours of psychological support. And furthermore, close to 2,000 people had that through telephone guidance and information. We rely a lot on volunteers, solid network of volunteers. This year we have 34 active, and of course they do the full spectrum of from psychological support to advocacy to utilizing social media and producing videos. And of course, ambassadors. We all know how important it is. Just mostly athletes. Let me give you an example. Yannis Foundoulis, here, this young guy, he's the captain of the Greek national polo team, which got a silver medal in the previous Olympics and was 4th in the Paris Olympics. So people well known to the Greek society that come up and speak and support our activities. Now, I don't have to say much about lung cancer in this audience, but Greece does have a major problem. Greece, together with Cyprus, are the top countries in Europe in smoking, and you could imagine what that means for morbidity and the burden of disease, COPD of course as well, for the Greek healthcare system and the people. Now, what we have achieved, by the time the Fairlife was created, we started really pushing and trying to lobby for lung cancer screening to be incorporated into the national health care screening programs. And indeed, this year, it will be starting on a pilot basis, but it will be starting a national lung cancer screening program. So let me now describe to you one of our activities, which is called Healthy Lungs. Of course, it covers, besides lung cancer, it's all respiratory diseases, and not only that, symptoms, risk factors. Our thinking is what it was mentioned earlier, empowerment. People don't change behavior just by informing them. We all know that. It's more than that. It's the empowerment. We have our fate in our hands. So this is how we created these events all over Greece to, first of all, help them understand that they have the power to make informed decisions. I think this is a key phrase, informed decisions for their health. And hopefully, as we continue doing this, by reducing the prevalence of the risk factors, we will see an improvement in the incidence of the diseases as well. So we create events in major cities. We started and our most recent one was in Thessaloniki, the second largest city in Greece. A full-day event where we invite from academics to influencers to politicians to talk about a wide array of topics, but all related to healthy lungs. So, because again, we want to ensure that access is knowledge, and they need this knowledge to make informed decisions. We've done major cities in Greece. We offered free lung cancer screenings and, of course, engaging in well-being activities. Created a personal website dedicated to this. A lot and heavy presence on social media. Podcasts with, again, influencers, physicians, academics. Creating a special app both for Android and Apple, and creating an animation video, creating also a specific pamphlet that everybody could have, so that moving the discussion in all fronts. And what I mean in all fronts, for example, within Thessaloniki, we had 98,000 first involvement from people. And we had 296,000 social media post stories and advertisements keeping up as a result of this. In addition to 48 articles in the various newsletters and so forth. So we want to have activity and awareness, and the more we discuss, the better and the more successful we become. Our next steps include, actually in a month from now, in Alexandroupoli, northern part of Greece. But also, our aim is not to go to the major cities, but cover the cities that, especially outside Athens, that are with a fewer population, but nevertheless with high prevalence of smoking. And we have to address, and we will incorporate further activities addressing this major new danger, which is called vaping. So this is the aim. We will continue these activities and taking and learning from events like this, because what we will do is we will take ideas and steal some of your suggestions to incorporate into our next activities. So we have a lot of things going on, and I'll be here to take any more questions. I know I speak a little fast, so apologies. I hope it was clear all I said. Thank you so much.
Thank you so much, Evie, for this interesting presentation. And just so you know, we will have one more speaker, and after that, it will be then the Q&A, and you can ask the questions. But now I invite Hilde de Keyser to present. Hilde is the CEO of Cystic Fibrosis Europe, and she has worked on a wide range of advocacy, research, patient involvement activities within Europe and international. So please, the floor is yours.
Thank you, Michaela. It takes both sides to build a bridge. If there's anything I want you to remember from the next 10 minutes here, I think that's the one. It takes both sides to build a bridge. And to do so, both sides need to have trust and to work together in openness and in real co-creation. We, CF Europe, I personally, we believe in patient-driven healthcare and policy. And many bridges need to be built to make that happen. And we are as strong as patients and patient organizations as our collaborations are, as our bridges are. Who's we? As I said, and as Michaela kindly introduced me, we as CF Europe, the European Federation of Patient Organizations of People with Cystic Fibrosis. And CF Europe envisages a world where people with CF live to their full potential in society, having access to optimal collaborative care until a cure is found. And if we want to move to and to work on patient-driven healthcare and patient-driven advocacy, we need to gather evidence on unmet needs. We need to speak up and have the voice of people with CF, of patients, heard. We do that in many different ways because it's, as I said, it's what we believe in. Patient-driven is not only having patient involved, but it adds a dimension to healthcare, to advocacy. It also helps get funding, and it increases the credibility when it's done well. CF Europe works on this in a number of ways and on a number of projects. And I will go into detail into one of those projects, but I'd like to say that this is the box that we're talking about more here, strengthening the CF community in Europe. We try to empower our members, the national patient organizations, to make sure they can work together on the national levels and do their jobs. We become a part of the conversation with other stakeholders. And there once I talked to somebody who said, it's not as if we want our place at the table. It's our table. And we want to make sure that our voice is central to that. So as I said, we work on several projects, and I will go into more detail on the twinning project here. And I forgot about this slide, but I like it, so I'm going to just talk a little bit about this, because I like it so much how over the last decade, or maybe 15 years, we moved from being outside of the circle, outside of the table. Of course, it's always been about the patient, but the patient was more of an object, to being at the inside. And now, ideally, we are part of the team. We're part of the circle. And that is where true co-creation happens, where true patient-driven healthcare and policy can become the norm. The Twinning Expansion Project. Why? Well, we've known for many years, and it's shown in articles and in research, that CF care is not the same all across Europe, that we had more challenges in certain countries than in others, that if we take it very black and white, the eastern part of Europe and the western part of Europe didn't have the same standards of care. And we wanted to change that. It's a reality we're faced with, and it's a reality we don't want to accept. So in 2020 already, the European CF Society, the professional network across Europe of clinicians and researchers, started a twinning project between CF centers. That was a good first step. And we were somehow involved, but if we go back to the previous slide, we were more like outside of the table. And in 2022, CF Europe, the patient organization, said, we think we could do better. So CF Europe secured extra funding, and a new call was sent out to CF centers, but also to CF patient organizations across Europe. Because what we said was, the only way of improving healthcare is to make sure that all stakeholders are involved. We know what is needed. We know what the reality is. This is a Twinning Expansion Project team, but of course there's many others. So what happened? In 2020, we had these 9 twins of CF centers across Europe. When we involved the patient organizations and we asked them, do you think it's useful for your country to be a mentor or a mentee in a twinning project? This is what happened. 21 new twins. 21 as opposed to 9. That is how true patient involvement can look like. Of course, that also means a lot of work. We wanted to use that momentum, so we now, in 2023, started with 21 new twins trying to work together. And these are the deliverables of the project, and I'm going into them one by one, so I'm not going to stop over this slide very much. So there is a new CF Center mentor and CF Center mentee side with the aim of facilitating collaboration and exchange between the twin pairs. The mentor side and the mentee side visit each other and create a long-term partnership in order to improve and optimize CF care in the mentee side. We start by identifying unmet needs, and that on different levels, on the level of the CF Center, on the level of patient organization, and on the patient level, because that's the only way of having a true view on what the needs of people with CF are. And then you come to very different needs, of course, and that's what you see in this visual, where it can be about quality of life as much as it can be about access to a certain treatment. So we try to have the entire picture of what it means to live with CF in a country. And then it comes to twinning. So as CF centers meet each other and create a partnership, also the patient organizations of the different countries that you see on this slide will meet each other, help each other, and become partners in their avenue towards optimal care for every person with CF across Europe. Knowledge is obviously important, and a lot of knowledge is available. It's about unlocking the knowledge to those who need it the most, and that's why in this project we translate resources, we share them online, we organize meetings, visits, but also conferences. We will have a conference in Romania, and that both on the clinical and on the more general level. So when it comes to patient organizations that can be about advocacy, about funding, about what they need to be able to advocate for patient-driven healthcare in their country. And then we facilitate this sharing of that and the networking opportunities for both the CF centers and the patient organizations in the different regions. So we actually try to bring people together, to talk to each other, to learn from each other, online, in conferences, and in visits. Because it's by talking to each other and by learning from each other that you can improve access to optimal care for every person with CF across Europe and beyond. And also there, what we see is that by asking patient organization and patients what their needs are, you get to better care, even if the answer might not be about treatment. In the end, it is about living the best possible life. And that is what it means to have good healthcare, to have your life being lived to the fullest of your potential. And as I started with a quote, I also want to stop with a quote because it's so beautiful. When I is replaced by we, even illness becomes wellness. And that's how we need to work together. Patient-driven, but having all the stakeholders on board, having a real open conversation and collaboration and co-creation. Thank you very much.
Thank you very much, Hilda. That was a really good presentation. Now that we've heard from all of our speakers today, we will now move to the question and answer session. So if you're in Vienna, please raise your hand, and if you're online, please just write your questions in the Q&A. Can we just please make sure that questions are short and the answers are also short, just so that we can get through as many as we can. We've got until 12:50, so 14 minutes to start. So I've got one question online which I'll ask first, which I think is for Evie. So how do you support patients in the areas which are affected by forest fires in Greece? There's a microphone maybe next to you, or...
So the question was, how do we support
the patients affected by the forest fires in Greece?
Oh, healthy lungs. Actually, we have the fair line, which is the number that anyone who would like to seek support could get. So it's for everyone. And, you know, we could always work ad hoc. If in one city there is a problem, and we have a huge network and an advisory board with many physicians and social workers that can go and assist. So although it's lung cancer, again, it's lungs, healthy lungs.
Thank you.
Hang on a minute. We have an order, and I know you will answer. We have one question from the floor, so please, there. Do you want to say something?
Okay, it's Dr. Mustafa from Saudi Arabia. My question to Evie again. You did talk about the screening for the lung cancer. So I was just wondering that what do you plan for screening? Is a CT scan or MRI for all the population? Or what's your plan for that?
Thank you. Give me the opportunity to expand on this. This is about the low radiation scan, CT scan, that has very specific guidelines who is eligible to take it. The national program, so if it has to do with the years of smoking, age, and so forth, assessing the risk. And as I say, in order to advocate, I need to perhaps share that with you, because that was the time that we wanted to push the government to include it. We conducted a study, Fairlife sponsored a study with academics, with the university, trying to show the economic and societal benefit in Greece by introducing a cancer screening program.
Thank you. Now we have from Victor, and I hope also you have questions to Nicole and Hilda. Take the opportunity, so please.
Well, first, thank you to all the speakers for these presentations. So I'm Victor from GAP, and I'm also a caregiver of a father with COPD who has lived in firsthand the advocacy work that APEPOC has done in removing the visa for the triple therapy for COPD. So that's my father now has triple therapy. So knowing how important advocacy is, and in considering that we are in Europe with the European Union, what is your advice? Is it better to go from the top down, as it, from the European Parliament, to create new policy, top down or bottom up? That means going to each ministry on each region, on each country. What is your recommendation?
We started with the ministry, but we have noticed that regional parliaments could be much more useful for this. And of course, if you have the opportunity to engage a specific, very important person, and I would like to announce that Dr. Maria Neda has accepted to be our next COPD ambassador. I'm very happy about this. So this is absolutely great, you know. But the health policy is done by the ministry, but it's carried out by the regional parliaments. So it's important to go to both. But maybe regional parliaments are more important than even the national ministry. But anyway, important to underline is that you have to speak to all political parties. Even if you think, oh my God, this is the right, this is the left, or whatever, it's not the party on the government, doesn't matter. It doesn't matter. You have to receive this teamwork and to transmit at least the importance, or to transmit at least the disease. You know, what we noticed is that most of the political decision makers not even knew the COPD. That's absolutely incredible. Apart from the doctors and nurses, of course, but most of them were lawyers, and they had no idea about COPD. And you can imagine that this is, for us, it was absolutely shocking, because we have 3 million of COPD patients, or potential 3 million of COPD patients here in Spain, and they not even know it. So coming back to your question, Victor, of course important the national level, but I think the regional level, maybe even the local level. Maria Neda said it before. She said, go to the mayor and talk about it, and talk about sustainability in that case, or talk about your disease, could be quite effective as well. Thank you for your question.
Thank you, Nicole. And now we have a question from Dimitris also.
1, 2. Okay, everybody will have questions. First of all, thank you very much for such a nice presentations. And I think each of these, it's a good practice, a good example, how you address in different diseases with a different, way of solution, or as policy strategy, or marketing and awareness, or mentor and mentee program. So I would like to make a same question, the three of you. What was the main challenge that you faced? One, the first challenge, the difficulty, and how you address it, or you are still trying to address it in order to have an examples. And so be honest and tell us what was hard, difficult, and how you overcome it if it is.
And short answers, each of you, so everyone can say something. Yeah.
Want me to start or what? Yes, yeah. So for me, for us, the main challenge was the time and how time intensive it was. And we were aware that we had to carry out a lot of meetings, that's what I said before. We had to go to all the regions, we had to go to all the parties, and this was absolutely took us a lot of time. But on the other hand, as we split it with remote meetings, and on the other hand with a person-to-person meeting, so what was a bit easier, but it was very intensive. So horrible sometimes. I had problems with my hair during this time, really, to be honest. So it was so stressy. But anyway, I think the results are quite good, and we are happy about this, and we will continue with this.
Look, if there is enough funding, we can cover every major and smaller city in Greece because people are willing, we have volunteers. So, of course, thank you to the companies that supported us, the pharmaceutical companies, and we will continue trying to seeking more funding. It's really the ability. We need the fuel to go everywhere. And the other challenge, which is easier, is to engage the local people to have follow-up and not just be one-off event.
Well, it's difficult to find one, and funding is obviously always an issue, but maybe the variety of needs and challenges across Europe was a real challenge for us to come to a project that is useful for everybody, being as tailor-made as possible.
Thank you. I think we have a question online now also.
This is for Hilda. Do you think you could talk more about and maybe give some examples of the knowledge that's been shared between the different sites, like the mentor site and the mentee sites, and how that's been beneficial?
Well, we do have, together with the European CF Society, so the scientific network across Europe, there are some tools and training modules that we made available. And we realized during the first twinning, so the 2020 project, that language is an issue. So we, as CF Europe said, if you really want to make a difference, we need to translate the tools there are. We need to unlock them, as I used the word I used during the presentation. Because there is a lot of knowledge available across Europe, and it is sometimes heartbreaking to see how it doesn't come to, or it doesn't reach the people that really need it, and that's where we tried in this project to really make a change in how to approach that. So making it available, translating it, and adding training. For those issues, there is no training available. And a very important fourth one is also for the patient organizations. We want to unlock the available training and materials that there are across Europe. We do so many things, all of us. And there's so many tools available on the national level across Europe. So making that available to a bigger audience can make a huge difference without reinventing the wheel.
Thank you.
Thank you. We have time for one more question.
Just behind.
Or somewhere here. No, it was this man. He raised his hand before, yeah, sorry.
All right, thank you very much, and thank you for your very fruitful and very insightful discussion. So my question goes to Nicole. I know being based in Spain, I think it was a great milestone having the removal of the visa for triple therapy on COPD patients, which I think it touches base with something that really tackles all of us, which is access. My question would be about the lessons learned in the process, because from my understanding you would have to negotiate with regional councillors, with the Ministry of Health, and at the very last point having the approval from the Spanish Parliament, so that demands establishing contacts with several stakeholders from policymakers and payers. And I know, although at the end the story has a happy ending, what were the hurdles that you were encountering as a PEPOC, as a patient organization, and what advice would you give us in terms of policy about how to overcome those barriers, and how we can effectively do a policy work in order to grant access to the best therapy for the patients that we represent? Thank you.
Thank you. Thank you for your question, very interesting question. You know, there are a lot of barriers. I spoke about the time, and you know that the politicians, they have a quite busy agenda as well. First of all, it's quite difficult to reach to them, you know. You have to get their contact and to write them, and when they have a little time, they say, tomorrow we can have a meeting, or we can have a meeting today. So you have to change everything in order to be with them, you know. That's sometimes horrible. You can't change the whole day. And in our case, we always wanted to be accompanied by a patient of the region at the same time as well, because as every regional parliament is very much focused on its own problems, so we need the specific experience of a patient or caregiver of this region at the same time as well. So can you imagine, you have there whomever, a spokesperson of a parliament of Aragon, for example, and they say, yeah, tomorrow we'll have a meeting at 12 o'clock. Okay, you have to move the patient and the caregiver and make it happen, you know, and this is really, for us, it was the worst barrier. Some of our patients were at the hospital with an exacerbation. They couldn't attend the meeting. Others didn't have any time or didn't want to be in the meeting, all this stuff. But you can't be alone. You have to be always together with a patient and with a caregiver and with experience, you know. They need to transmit really the importance of the burden of the COPD, not only being there. That's not enough, you know. So you need patients, communicative patients with quite a lot of experience. So you need patient experts, and you have to train these patient experts first. I think this is the most difficult barrier for us, or was the most difficult and will be the most difficult barrier for the next future as well. We have other dates for the next week, for example, and we have to change everything due to the agenda of these people. But if we want to achieve something, we have to do it. No other way, no other way. Thank you.
Thank you. Unfortunately, that's all we've got time for today, for the Q&A session. Thank you all for your insights, panelists, and thank you all for your questions online and in person. Now, just before we break for lunch, we want to show a short video with some examples from patient organisations about how they approach some of the challenges of policy and healthcare change.
I'm Katie Crunner, Vice President of Advocacy and Patient Engagement at the Pulmonary Hypertension Association. Pulmonary Hypertension Association believes that anyone touched by PH has the right to a world where they can thrive. PHA empowers our community with the tools and resources to advocate for that world. I think of advocacy as asking an individual or a group with power over a situation to use that power in a specific way. Through PHA's grassroots advocacy network, PH advocates, including patients, their families, and the healthcare professionals, build long-term relationships with legislators and regulators to keep PH top of mind in policy decisions. Advocates can build those relationships with power holders through emails and phone calls, through in-person or virtual visits in their home state, even through PHA events on Capitol Hill. Right now, PHA is advocating to improve oxygen access, to decrease barriers to therapy access, such as prior authorization and step therapy, and to increase research funding. I encourage you to consider, what is your advocacy goal? Who has the power to make that goal a reality? And what can you do to influence that person or group? You can learn more at phassociation.org/advocate.
Hi everyone, it's Tanya Winders, the President and CEO of GAP and the head of the Speak Up for COPD Coalition. I'm excited to come to you today and to give you an update on the Speak Up for COPD Coalition and the work that we've been doing across the world, but also here in Europe as you're meeting for ELF. So number one, the Speak Up for COPD Coalition is a multi-stakeholder coalition that includes patient advocates, that includes industry partners, that includes a number of professional societies and a variety of stakeholders that really make up that care team for individuals living with COPD across the world. And we have a single aim, and that is to elevate COPD as a public health priority. And so over the course of this year, we've been focused on building out our coalition partners, certainly getting our governance structure refined and in place. And then we've been working on two important initiatives. First is what's called the Gretel Initiative, and we will have the readout of this actually at the GAP Summit on September 5 and 6, where we look at all the landscape, all the different influencers into policy to elevate COPD in the public health conversation. And so this landscape analysis, this Gretel readout, will be instrumental in then determining how we target at the country level and at the global level to, again, get that policy prioritization that we're looking for. And then the second main project is the State of COPD report. And again, we're so excited that this is going to release on September 6th at the GAP Summit, and then will be amplified in the months to come across all the different stakeholders of the coalition leading up to World COPD Day. And the State of COPD report actually has a global report, and then we have 10 different country profiles that look specifically at what is the current state of prioritization of COPD and what are some of the ways that government officials and public health officials can prioritize COPD or implement programs to elevate COPD. So this is a very important baseline report on the state of COPD that can be utilized across European countries, but also globally. And we'll be amplifying it throughout the weeks leading up to World COPD Day. And then forthcoming at the World Health Summit in October, we will have the release of the COPD Index. And this is a report that looks at COPD policy across 36 different countries and more than 40 domains. So that will be released at the World Health Summit on October 14. And then finally on COPD World Awareness Day, the World COPD Day, November 15th, we will have a coordinated communications effort with a full toolkit that will be released to all of the GAP members and to all of the coalition stakeholders. So thanks again for allowing us a few minutes just to update you on the Speak Up for COPD Coalition.
I'm forever tired, but I must get out of bed. Another day at the hospital, getting my test done. Doctor says, very good, and I get up and run. It's a lonely thing, carrying this weight. My body, pain and wreck, I just say it straight. Lungs on steroids, let me be at ease. Lungs on steroids, interstitial lung disease. Lungs on steroids, let me be at ease. Lungs on steroids, interstitial lung disease. Woo! Down, down, down. Do, 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 do. Ba, 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 ba. Boo, 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 boo. Ba, 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 ba. Boo, 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 boo.
Okay, thank you. Thank you for that video. That was really cool, seeing what everyone's doing around the world and also having that lovely song. We are now going to a break. So this is the end of the morning session. So there's going to be a 1 hour break for lunch and for you guys to do more networking. The lunch is served over there in the back right corner for you guys of the room. After lunch, we will be going into group discussions and you will have been allocated a table. If you're not sure what table you're on, please check with the ELF team during the break. And when you come back after the break, please sit in your allocated table so we can quickly get on with the discussions. This is it for me and Michaela. You will have 2 new chairs in the afternoon session. You've got Helen Parks and Abdullah. So on behalf of myself and Michaela, thank you for your participation. And yeah, Michaela?
Yes, I just wanted to say, coming together like this, showing what amazing work is being done, it really fills my heart with joy. And also, if you didn't have the possibility to ask questions to these 3 speakers, use the lunch also. But there's one word that always comes in my mind now. It's together. Together, we can make a change. So keep up the good work, and thank you for this morning.
Thank you, everyone.